The honourable member for Mission Matsqui-Fraser Canyon.
Thank you, Madam Speaker. The Liberal minister responsible for legal hard drugs is misleading Canadians. This government is claiming that the so-called Safe Supply program is working, but the facts say otherwise. In Abbotsford alone, the number of overdoses between 2013 and 2022 went up by 820%, meaning that Abbotsford has seen a near 1,000% increase in overdoses over the last 10 years. The minister should also be aware that in 2014, unregulated drug deaths from fentanyl were at 22.2%, but by 2023, this figure had soared to 85.3%. BC Health Service delivery areas reported 990 unregulated drug deaths in 2019 and over 2,500 deaths in 2023. Despite the BC Medical Association's 2009 recommendations for addiction care improvements, treatment bed availability has remained stagnant for 15 years. Clearly, there's a disconnect between the Liberal government, Canadian tax dollars, and the true needs of Canadians in this field. The minister must acknowledge the failure of legalizing hard drugs. Even our premier, Mr. Eby, is backpedaling on these policies which have caused devastation in our province. This government owes an apology to all those it harmed by their radical drug experiment over the last year. The 2023 federal budget announced the piddly $20.2 million for new community-based program to prevent substance abuse in young people. We don't know where any of that money is going or how it's going to be spent. Currently, drug overdoses are the leading cause of death amongst youth aged 10 to 18 in British Columbia. A boy named Jacob Wilson in my riding tragically died from an overdose at age 21. He was turned away after repeatedly seeking help and support at our local hospital. Recently, an 18-year-old University of Victoria student died of an overdose, and schools across BC are now calling for an expansion of emergency measures, such as training students for CPR and the use of naloxone kits. And I might add, that's not only at universities, but in high schools as well. Let that sink in. Children in our high schools have to be trained on the use of naloxone because drug toxicity is the #1 cause of death for kids aged 10 to 18. In my own riding in British Columbia, parents have to routinely clean up needles at our parks where children play soccer. This weekend, I asked one of the key coaches, I'm like, hey, how many needles have you found this week? Oh, we find them every day in the corner right over there on the field where my kids and hundreds of other kids play every week. Public beaches now post signs warning of dirty needles at the most popular spot to play beach volleyball at Kits Beach in Vancouver. The minister's recommendations on this radical experiment have not helped our children. People are scared to go on public transit. People are scared of our downtown cores. People are scared to visit certain shops and restaurants at certain times of day. People are scared of going into our hospitals. Businesses across British Columbia are outlining a deteriorated climate and talk about a crime tax because of hard drugs. The RCMP has confirmed that the so-called Safe Supply has infiltrated the black market. When will this government end this radical experiment so that our communities can feel safe again?
The Honourable Parliamentary Secretary to the Minister of Families, Children and Social Development and Minister of Mental Health and Addictions and Associate Health Minister. Well, the colleague might be healthy to have his video clip to share, but I would like to correct course. The overdose crisis is one of the most serious and complex health crises that Canada has ever experienced. There is no easy solution because the drug supply is becoming increasingly unpredictable and lethal. Now, the crisis is also underpinned by socioeconomic disadvantages and lack of access or barriers to accessing treatment. Together, we can overcome the negative consequences of this crisis and unnecessary deaths.
Address this crisis alone. That is why we are working closely with all orders of government, Indigenous communities, partners and stakeholders to implement an holistic approach to addressing substance use and related harms focused on promoting public health and protecting public health. Travailler avec les provinces, les territoires.
We need to work with provinces, territories, and other partners across the country. We will implement the solutions that they propose. We will track the implementation of solutions and adjust as needed. If we can't keep doing the same things and expecting different results, we need to be open-minded to find new solutions to put an end to this crisis. Had the Conservatives participated in the Health Committee's trip, they would have heard from organizations who are working very hard on the ground every day.
For personal drug possession demonstrates this point. We granted BC's request to prohibit the possession of controlled substance in public spaces because the province identified a concern and sought to adjust their approach. BC told us these changes were needed to provide law enforcement with additional tools to address public drug use when safety issues arise, while ensuring that they continue to treat personal drug use as the health and social issue it is, and we listened. La sécurité publique est une...
Public safety is a priority for our government. We are working hard to find innovative solutions to the current drug toxicity crisis. We are working very closely with our national and international partners, including with Public Safety, the RCMP, the CBSA, and Canada Post. We are working with all partners to put an end to illegal drug supply. We also want to give law enforcement the tools and resources they need to intercept illegal drugs and their precursor chemicals. And we are working with private sector partners to counter drug laundering from the proceeds, money laundering from the proceeds of drugs.
Sur des preuves.
We need evidence-based supports and services and solutions to help with this crisis. In Budget 2024, we commit $150 million for a fund to support the hardest-hit municipalities and Indigenous communities. This funding will allow rapid responses to the most heavily affected communities. They have urgent and critical needs for funding.
With timely access to prevention, harm reduction, treatment, and recovery services and supports they need, we will continue to work with municipalities, provincial and territorial governments, law enforcement, Indigenous communities, and people with lived and living experience.
The honourable for Mission Matsqui Fraser Canyon.
Well, thank you, Madam Speaker. And to the member from Sherbrooke, I'm not looking for a clip. I'm addressing the incredibly challenging situation we find in British Columbia today. So my question to the member from Sherbrooke is, if given the chance, Madam Speaker, would she legalize hard drugs as her government did in British Columbia? Given the chance, would she agree, or given the chance, would she adopt a policy that has led statistically to record overdose deaths of children from hard drugs? If given the chance, would she repeat the horrendous policy that has really made British Columbians lose faith in our institutions and public order? If given the chance, would she do that in Quebec, Madam Speaker?
L'honorable député de...
The Honourable Parliamentary Secretary. Thank you, Madam Speaker. We need to remember that all drug users must have access to appropriate services for them. We can do so by offering a broad array of services, which would increase the likelihood that they will find services that work for them. Stigma can be a barrier to accessing services, and that's why fighting stigma is a priority for our government. When drug users feel that they are judged, they hesitate to seek support or use available services. They may also conceal their drug use. What we aim to do is to have policy and programs which are based on health care and compassion. We want to live in a society where drug use problems are seen as a chronic health problem treated without judgment.
Services is part of a broader approach across these systems with the goal of reducing harms and saving lives while keeping communities safe.